Welcome to The Explainer. Today, we're going to tackle something that affects every single one of us, our health and how we pay for healthcare here in India. We're going to break it all down, drawing on the fantastic work of Dr. Sudhindra S.G. to make this whole complex world a lot simpler.
You know, we've all heard this saying a million times, right? But what does being healthy really mean today? And maybe more importantly, how do you protect that wealth when things go wrong? Well, that's exactly what we're going to explore.
So, here's how we're going to break it all down for you. We'll start with the basics, what health even is. Then, we'll walk through the healthcare system, look at the big challenges India faces, understand how insurance acts as a safety net, and finally, get to know the key players in the game.
Okay, first things first. Before we can even begin to talk about hospitals or insurance policies, we need to be on the same page. So, what exactly is health?
For a long time, people thought of health as something, well, almost magical, a divine gift. But then, brilliant thinkers, pioneers like Hippocrates in Greece, and our very own Sushruta, the father of Indian medicine, started looking for real, scientific reasons for why we get sick.
And that brings us to this modern definition from the World Health Organization. Read that again. It's not just about not having a cold, it's about complete physical, mental, and social well-being. But here's the amazing part. This so-called modern idea, it's been at the heart of Indian systems like Ayurveda for centuries.
So your health isn't just about getting lucky. It really boils down to this mix of three things: the choices you make every day, the world you live in, and of course, the genes you inherited from your family.
All right, so when you do need medical care, where do you actually go? The system is set up in 3 different levels. Let's see what they are. The easiest way to think about it is like fixing your car. Your friendly neighborhood mechanic for a quick oil change or a weird noise, that's your primary care. If it's something more serious, they send you to the official brand service center. That's secondary care. And for a total engine rebuild or some super complex issue, you're going to the main factory, the specialist. That's tertiary care.
And here's the kicker, the reason this really matters. As you go up that ladder from primary to tertiary, the cost, well, it doesn't just go up, it shoots up. Understanding this helps you see why some treatments can get so expensive.
Now let's zoom out. Providing healthcare in a country like India is, to put it mildly, a huge challenge. Let's look at some of the big factors that make it so complex.
It all starts with this one staggering fact. We are the second most populated country on the planet. Just think about the sheer scale of demand that puts on every single doctor, nurse, and hospital bed in the country. It's enormous.
And it's not just about how many of us there are. It's about how we live. More of us are moving to cities, working desk jobs, and living less active lives. And because of that, we're seeing this explosion in lifestyle diseases like diabetes and high blood pressure. It's a whole new kind of health challenge.
But amidst the challenges, look at this. This slide tells an absolutely incredible story of success. We've literally doubled our life expectancy since independence. That's fantastic news. But it also means we now face a new challenge, providing more and more care for an aging population.
So you've got this perfect storm, right? A huge population, rising costs, and new kinds of diseases. A financial safety net wasn't just a nice-to-have anymore, it became essential. This is where health insurance steps into the story.
It didn't just appear out of nowhere. The government got the ball rolling right after independence with schemes for specific groups. But the real game changer for the average person, the big bang moment, was in 1986. That's when the first Mediclaim policy hit the market.
This is a perfect example of a brand becoming bigger than the product itself. Mediclaim was so popular, so groundbreaking, that the name just stuck. It became the Google or the Xerox for health insurance in India. People don't say I need health insurance. They say I need a Mediclaim policy.
Okay, so let's say you decide to get a policy. Who are you actually dealing with? The whole system can seem pretty confusing, so let's quickly break down who the main players are.
When you boil it down, the whole market is really made up of 4 main groups. You've got the hospitals and clinics who actually provide the care. You've got the insurance companies who take on the financial risk. You've got intermediaries, the people in the middle. And you've got the regulators keeping an eye on everyone. Now, you've probably heard this term TPA. What on earth is that? Well, think of a TPA as the behind-the-scenes coordinator. They're the ones your insurance company hires to handle all the paperwork, talk to the hospital, and make the whole cashless process smooth for you. They're like the event planners for your hospital stay.
This table is your cheat sheet. Here's the most important difference to know. An agent works for a specific insurance company. A broker, on the other hand, works for you. They're your personal shopper, looking across many different companies to find the best policy for your needs. And the TPA? They work for the insurer after you've already bought the policy.
So who makes sure everyone plays by the rules? Who's the referee in this entire game? That's this body, the IRDAI. Their job is to protect you, the customer, and make sure the whole system is fair and transparent.
Whew! Okay, we have covered a lot. So, if you only take away a few things from our explainer today, make it these 4 points. Health is holistic, costs go up with complexity, insurance is your safety net, and knowing the players puts you in the driver's seat. And so we'll leave you with this final thought to chew on. Now that you've seen how the pieces fit together, what do you think is the one big change that could make a real difference for everyone? It's a huge question and one worth thinking about. Thanks for joining us on The Explainer.